name is Jane Sullivan, and I'm very happy to be here today to acknowledge the Department of Mental Health and to tell you a little about what they have done for our family. My husband Jack and I are the proud parents of 3 children, all of whom are adopted. Our beautiful daughter Meg was adopted from a Russian orphanage at the age of 1. We then began the very long journey that has led us here today. Meg has been diagnosed with reactive attachment disorder and the trauma of early neglect, or PTSD. Along the way to finding the true diagnosis and treatment, there were also diagnoses of ADHD and mood disorders for which she received medication and counseling. Despite our best efforts to help her, her struggles got bigger. We dealt with multiple doctors, psychologists, and psychiatrists over the years. And for all the sadness, fear, and loneliness we felt as she struggled to fit in school, at home, with her family, and with friends, the struggle was always so much bigger for Meg than it was for us. It was devastating to watch. This beautiful, bright, funny, talented, compassionate girl saw herself as worthless and bad and undeserving of love from anyone. And she set out on a mission of self-destruction to prove it. Then we found the Justice Resource Institute, or JRI, and Meg's brilliant clinician, Liz. It was Liz that urged us to apply to DMH in the first place. What could they offer us, we wondered? After all, we hadn't done so well with all our years of privately paying for the best services available. Liz persevered and explained that we would really need DMH for support when Meg graduated from the JRI program. After JRI was a very scary thought, so we applied, but we really didn't expect much. We went to an initial meeting at the Tewksbury State Hospital, and we had a moment of revelation sitting around that table. These people were listening to us. After years of being dismissed by the Andover School District, by doctors, psychiatrists, psychologists, these people asked pointed, caring questions and listened to what we said. It was obvious that they really wanted to know what Meg was like and what she would need. Thanks to Jack Lyons, we left that meeting daring to hope that they could help us to help Meg. Then we met Meg's DMH caseworker, the fabulous Sue Kingston. Sue had her work cut out for her because Meg not only didn't think she wanted to be loved, she didn't want to be liked, and she certainly wasn't going to let herself like Sue. But Sue worked her magic in her kind, quiet, and patient way, and the rest is history. We will never forget Sue Kingston. We went on to have more meetings with DMH. Each one was just so caring and compassionate. Jeff, Rachel, when I think of those meetings, I think of your kind face looking back at me if I got emotional about what we had been through. Things are falling into place for Meg now. She's joining the TIP program and has so much to look forward to through that, with all that they offer in terms of making friends safely, activities, employment, all of which will support her safe transition home. Meg is coming home. I guess we expected a very generic kind of offering from a big state agency like DMH. What we found instead was a very personal brand of kindness, compassion, understanding, and expertise, all of which is bringing our beautiful daughter home to us. The services provided to our family by the Massachusetts Department of Mental Health, as well as the people providing them, are priceless. Thank you all so much.